Appetite suppressants can be a very useful part of a comprehensive weight management program. However, it's important to understand what they do and what they don't do. First off, appetite suppressants do not significantly increase your metabolism. So if you think you're going to take a pill, continue eating what you were eating before, assuming you were overeating, which most overweight people are, and have the pounds melt off because of some increase in metabolism, you're going to be sorely disappointed. What appetite suppressants do allow you to do is eat less, or more importantly, help you break the emotional connection with food. In order to avoid becoming dependent on them in the long term, it's important not to eat too little when the appetite suppressants are at their most effective state. When you first start, oftentimes people don't want to eat at all. You might take an appetite suppressant pill and think, well, I don't need to eat at all. You may lose weight very quickly in the beginning, but due to the drastically reduced calories you're consuming, your metabolism will eventually catch up. The weight loss will stop, and then you're stuck because you're eating so little. At that point, you're forced to stay on the medications in order to sustain such a reduced calorie diet, which is not beneficial in the long run and will most likely leave you as heavy or heavier than you were before you started taking them. There's a better way. If you use appetite suppressants to allow you to break your emotional connection with food or to avoid food in certain social circumstances that you've been programmed to eat in, you can continue to lose weight without experiencing the metabolic slowdown that you would get by drastically reducing calories. The beauty of this is, because you don't want to eat, it's almost like you're force-feeding yourself a certain amount of calories. That way your metabolism will stay high as you lose weight, and when you hit your goal weight, you're not stuck in a state where you have to starve yourself for the rest of your life in order to maintain it, which is neither healthy nor practical. By using appetite suppressants as a means to adjust the calorie intake and your relationship with food, you will end up much better off in the long term and not be reliant on the appetite suppressants for the rest of your life.